Welcome, my friends. I've been gone for so long, and sometimes you have to do some issues out there. Sometimes you can plan something, and then you find yourself having some one, two, three things that are not adding up. So, my friends, welcome to the platform. I can see Peter was here and said, "Hey, Peter, how is you from Norway? Peter from Norway, just imagine." From Norway here. Welcome, my guys. The weekend has been so long, and we thank God. We thank God for everything. We thank God for whatever that we are going through. Uncle is here. Jamaican uncle always there, ready to watch. I miss everyone. I miss everyone. I miss you guys. Although it's still a holiday here, children have not gone to school. We are all here waiting, and although I've been coming online to tell my people that I'm still around. I'm still boss is here. Boss, I miss you guys, man. I miss you guys. But the weekend has been so long. The weekend has been so long, and ups and downs. Work, social life. It makes you sometimes to stay underground. It makes you sometimes to stay underground. Work, social life, ABCD out there. Now, I had promised we will continue with hypertension, but the requests that have come in are so many. There are so many requests that are saying, let's do what? Let's do Ebola. Ebola is trending right now. Ebola is trending right now, and Ebola is everywhere. You can see even in Kenya, Trump and our government here, the US government, our government are trying to prepare a rescue place here in Kenya, a quarantine place here in Kenya for Ebola patients. So everyone who is watching and who is coming in, if it's your first day watching Benjamin the Wise Guy, do what? Hit the like button. Let me see you hitting the like button and subscribe to this channel. Today we want to talk about yeah, you're looking so fresh today. Yeah. It's been long, uncle. It's been long. Ups and downs, social life. I can see more people coming in. Tell us where you're watching from. Subscribe to the channel if you have not subscribed. Please subscribe to the channel. Don't just watch and go. Today I'm looking fresh. A little good rest is important. Fatigue was killing me, uncle. Boss, fatigue was killing me. But today I feel relieved and I'm feeling good, I'm feeling good, and everything is fine over here. And I thank God for you guys. Some of you are asking me, hey, Doc, what's happening? Like Savior Man told me you've taken rest for outside YouTube so that you can take, So please, if you are watching, if you are a new person, you know what to do, subscribe. And we have some good people in my chat here, the good fresh people like Jamaican Uncle, Boss One, every person who is coming at the chat, come on and interact with them, and you'll be good as you interact with the people that are in the channel. So my friends, sometimes you have to take a rest. So today we'll be talking about Ebola disease. People are asking, why is the US government placing a quarantine center in Kenya? Why? And the Kenyans are asking again, why do you want to bring your sick people here? Why should you quarantine your sick people here? You should quarantine them where you are. Quarantine them in your country. You will know how to deal. All those questions will deal with them today. So welcome again, everyone. If you are here watching for the first time, Benjamin the Wise Guy, you know what to do. Hit the like button, subscribe to the channel. Hit the like button and subscribe to the channel. Welcome everyone. So let's talk about Ebola. For you who is watching, do you know what Ebola is? Have you ever asked yourself what is Ebola? I know people just know it is a viral infection. Ebola is a viral infection, but the details of Ebola makes people don't know. And why should people be quarantined? Why should they be not? Why should just they go to hospital, be treated, and go home? Why should they not do that? Why should they be quarantined? You know, some things are worth asking the question. So let's discuss what Ebola is today. For the next 1.5 hours, we will be talking about Ebola. So the people who are new to the channel and you are watching and you feel this is Benjamin the Wise Guy, you're doing good job, please subscribe to the channel and hit the like button. Tell us to the chat, text there, tell us where you are watching from. It is very important to know. You know, if you are watching from the US, tell us I'm here watching from United States. If you are watching from Kenya, Africa, if you are watching from Asia, if you are watching from Russia, please tell us where you are watching from. Let's know, let's get to know you. Don't just eavesdrop and run away. Don't just eavesdrop. Tidrin. Hello, Doc. Your name, Ahmed. Your name makes me have problems pronouncing it. Ahmed, welcome to the channel. I'll be calling you Ahmed. I'll be calling you Ahmed. Hello, Doc. I'm fine, Ahmed. Today I've resumed and I feel good and I feel better that you are here. Now, you who is watching and you have not told us where you're watching from, please tell us where you're watching. Queen! Queen is here. I was watching yesterday Queen at night while I was giving people some bedtime stories, my people. And Queen was there doing her thing, spiritual advisor, spiritual nourisher, counselor here, Ebola is a deadly disease and it kills quickly. Yes, it's a viral deadly disease and it kills quickly. We have seen Queen has said, "Happy Monday, Doctor," watching from Rochester, New York. Queen is watching from Rochester, New York. Boss, welcoming Queen to the chat. You who is watching and you have not liked, please like the chat. Like and tell us where you are watching from. Tell us, man. Don't just watch and go. Tell us, interact with the people here. Tell them I'm from this and this place. I'm new here. Where do I sit? What do I say? Where do I sit? So welcome, my people. Welcome to the platform now. Ebola virus disease is a severe, often viral hemorrhagic fever caused by virus at the genus. The family, the gene is a category of a disease or a parasite, or we have family, we have genes, So the genus of this Ebola is called Ebola virus disease. Genus, it's called Ebola virus disease. And then we have it is primarily affected human and human primates. So Ebola can affect you and Brenda Kuma, welcome. Good day, Benjamin the Wise Guy. Brenda is here, my friends. Say hi to Brenda, my people. Welcome Brenda to the chat. Tell Brenda, have a seat. Let's talk about Ebola disease. Now, the genus is called Ebola virus disease. Boss, welcoming Brenda. Big up yourself, boss, all the time, man. And the boss is the disciplinarian. Never laughs. If a person comes to the chat with nyef, boss will deal with you. Yes, we are talking about Ebola. So it primarily affects human and non-human primates and is characterized by fever, systemic inflammation, vascular injury, and multi-organ dysfunction. Let me repeat that. This is often viral hemorrhagic fever. Anytime you see a place it's written hemorrhagic fever, you understand that it is a disease that can cause you to bleed. Hemorrhagic fever is a disease that causes you to bleed. So Ebola is a hemorrhagic fever. Is when you get it, you can bleed. Fever caused by the name of the virus is called Ebola virus. Ebola virus, and it primarily affects. We say it affects human and non-human primates. So you are a primate. You remember how the evolution of a human being, Ramapithecus, Homo sapiens. So as we are Homo sapiens, so the primates are the family of primates. It affects primates. So a baboon, an orangutan, orangutan is a big baboon. It affects that generation of human being plus its primates, primates, non-human. So it affects non-Homo sapiens, as we are Homo sapiens. So welcome, my friends. I can see people watching, but you have not liked the chat. Please remember to hit the like button to bring more impressions to hear, to bring more impressions to many people, so that they can come and listen to what we are talking about, Ebola disease. So if you have not subscribed, please subscribe. Please subscribe, my friend, and come to the chat. Talk to my friends at the chat, like Brenda, Jamaican Uncle, Boss One, all these Queen, Queen. Ask Queen, why are you the Queen? Welcome, my friends. Here we laugh, we feel good, and we continue with the topics. We laugh, we live, we feel good, and we enjoy each other with good conversation at the chat. So tell me what you understand about Ebola, or you just listen you listen about this is a great topic, very important, Jamaican Uncle. It's a great topic. It's a great topic. Don't just listen. Tell us if you have a question, come to the chat. Praise that praise. You see, another friend of mine is here. Praise that pray. Ebola is an African virus, correct? Any danger of it spread beyond Africa? Yes, you can have a danger of it spreading outside Africa. If a virus, you can get it through several ways, for which we are going to see. So the containment depends with the population and the movement. Containment of the virus depends on the population and the movement. So let's see how this virus can be contained, and why, if it is not contained, it can be so fatal. Now, the coffee cakes. Welcome, coffee cakes. I miss you. Did you download WhatsApp, man? Did you download WhatsApp? And you're not, we have not talked, like, if the weekend has been long. If you have WhatsApp and you are my member, I can call you and ask you, are you going through well? Is everything okay? Yes? Welcome, the coffee cakes. Yes, I sent to you. Oh, you sent to me. Where? In Instagram? Or which one? Okay, let's continue. I'll get it. We have said that Ebola affects on Instagram. I'll check it out. We have said Ebola affects primates, and these primates are, Kenya has rejected the building of the Ebola clinic. Yes, the have rejected, but we don't know about the government. Let's talk about Ebola, then I'll answer that question Queen has asked. That one. Sorry, I can't visit you last night, Queen. I a little hassle with the video. Okay, now let's see, my friend. Let's continue and see. Let's continue and see this. Causative agents is Ebola. We have said the virus itself is called Ebola. Members of the family Filoviridae. You know, there are some a way how you can categorize some things. We have Ebola, but with Ebola it has its family. So what do we mean by Filoviridae, the family of Ebola? What do we mean by Filoviridae? If you are new to the channel, please subscribe to the channel. Subscribe to the channel. So Filoviridae means is a family of single-stranded negative sense RNA. Negative sense RNA. So RNA means, let me explain this first so that you understand. RNA means it multiplies by copying your DNA so that it can produce more, just like HIV. So that it can create what? It can create more of the virus. If it had a DNA, it could not copy. But now that it has negative ribonucleic acid, it means it has to copy your DNA strand, and then it develops more viruses. Praise that pray asks any concern about international sporting events spread the virus, such as World Cup. What precautions are being taken ahead of World Cup being a catalyst of the infection? Now, according to politics and political arrangements, that one I may not tell, but if something can be spread, let's continue and know. If I'm working, listening in the back, okay, nice. If something can be spread through, let's praise that praise. Let's continue. We have just started. I'm explaining a very important point. If you see, it is called an RNA virus. It is called negative stranded virus. It relies on your DNA strand. It copies it so that it produces other more viruses. Now, let's talk about, we have categorized it. It's the family, the gene Ebola virus, that is the genus. Members of the family which has a DNA, a negative strand called Filoviridae, which means it doesn't have DNA, it has a ribonucleic acid. You see, Filoviridae. Anyone with a question about that? Filoviridae is a family of single-stranded negative cells as the RNA virus in order. Single. It doesn't have multiple. Single. So copying your strand makes it produce more strands. Now, let's continue now. Ebola has species. It's not just Ebola is caused by Ebola virus, members of one-stranded RNA. Species that have, it is not just one that Ebola is Ebola, it has several species. So you can find that the Ebola that is in Congo is not the Ebola that has been found in Kenya, and it is not the Ebola that can be found in USA or Australia. So the species that are of Ebola, some of them are Zaire Ebola virus, the one that was found in Zaire. It is the most bad, the Zaire Ebola virus. And you remember, it is a zoonotic disease. Zoonotic means it can affect baboon, primates, orangutan, those ones, monkeys. So the people that live with monkeys, we have some people who live around with monkeys, So in Zaire, Ebola virus, that one is 1. We have Sudan, Ebola virus, that one is 2. We have Bugio, Bundibugyo, Ebola virus. We have Tahi Forest, Ebola virus, and we have Reston, Ebola virus. There are 6 types of Ebola virus out there, my friends. Just imagine 6 types of Ebola virus. And the distribution where they are found, where Ebola virus is found, we call it distribution. As we continue, if you are not you are not getting it right, you ask a question. You ask a question to where you are not getting right. Epidemiology. Epidemiology means distribution, where they are found, the distribution. Major outbreaks have occurred in Congo, where it started, and you know it started in the forest, because you have said it can affect human and primates. Primates are baboons, all those, monkeys. So Congo is the one which started it. And then we went to Uganda, my neighboring country in Kenya. Yes, Guinea, Sierra Leone, and Liberia. You see, these are African countries. And in African countries, we have we call them tropical diseases that are found in Africa, like malaria, the Ebola itself. We have very many dengue fever. If you have ever heard of dengue fever, schistosomiasis, all those are called tropical diseases. So whatever I'm talking about here, I'm talking about something that is tropical disease. Tropical disease are diseases that are found in the tropics. Africa. The largest outbreak occurred in West Africa from 2014 to 2016. West Africa, Congo. The countries of West Africa like Togo, Nigeria, Guinea-Bissau, all those, Guinea, Congo, those ones in Africa. So how do you get it? Anyone with a question? I've explained what Ebola is, and the family of the virus is a single-stranded RNA. If a virus has an RNA, it means it has to get to a person, or it has to get to another living organism so that it can multiply, because it has to copy your strand. Ribonucleic acid can be replaced. It is called uracil by adenine and thymine, so that it can come up with another strand that is and the same Ebola virus. And when it is replacing your DNA, that is where problems come. You start bleeding, you start having hemorrhagic fevers. Now, let's talk about transmission. How is it transmitted? How is this thing transmitted? If you come in contact with bats, it does not affect the bats. It does not affect some of the living organisms. But because of the human DNA and the DNA in some people, it can affect you. We will see why it can affect. So, bats live in the jungle. Monkeys, chimpanzees, gorillas, antelopes. You see, most primates that are in the line of human, like us, we are called Homo sapien. The others, like baboons, they are in their categories, but we are in the same family home. It can affect them. So people that are living with baboons and monkeys, you have to take good care of yourself. You have to take good care of yourself. Why? It attacks primates faster than other living organisms, antelopes. Now, you can get it through blood, organs, and body fluids. You can get it through blood, organs, and body fluids. Exchanging blood, organ transplant, and body fluids. Exchanging body fluids. But we have human-to-human transmission. You have gone to the jungle, you have killed a primate. You know, there are some people out here that eat monkeys and baboons. There are some people out here that eat monkeys and baboons. So when they kill an infected monkey, they eat it. And you can go to their streets and those primates are there. They are selling them. You will get it. Body fluids, exchanging body fluids, you understand? Like saliva, urine. Let's talk about human to human transmission, which is very important. Let's talk about human to human transmission. What do you think about human to human transmission? Because we have said fluid exchange can cause this problem. Fluid exchange can cause this problem. Now, human to human transmission, blood, saliva, vomiting, vomit, urine, semen, breast milk, and sweat. Imagine even the sweat, because when something is a ribonucleic acid, I want to explain something there about ribonucleic acid and DNA so that you will understand why even saliva, even urine, vomit, everything can affect you. We want to know why. Guanine, thiamine, adenine, and cytosine. Now, my pens are going off. I have written until they are going off. My pens. Now, this one. Your DNA is written like this: guanine, thiamine, adenine, and cytosine. Your DNA strand is written like that. But the RNA strand, the RNA strand. Now, this is an RNA of RNA strand. The RNA strand is written like adenine, cytosine, guanine, and uracil. So the RNA is like this. The RNA. Now, DNA is written as guanine, thiamine, adenine, and cytosine. And RNA is written as adenine, cytosine, guanine, and uracil. So this one, the uracil, is when the Ebola virus. Where is uracil? Yes, this one. When the Ebola virus wants to multiply, they go inside your cell, and then they do what? They displace them. They remove this and they take this. Now they copy your strand. This guanine will start. This cytosine will go here, because this is yours. This is the virus now. And then this uracil will be misplaced. Now the thymine will come here, and then it will elongate. So your cell will produce another virus through a process of translocation, transcription, and multiplication, So that is the problem of the viruses, and that's why it is called filoviridae. Filoviridae, it means it has got one strand of RNA. And a ribonucleic acid has something that is called uracil. It doesn't have thiamine, but the other one, this one, it doesn't have, your DNA doesn't have uracil, it has thiamine. But this one can be misplaced. It acts like something that transports and copies. So let's talk about human to human transmission. So if it has gone to your blood and it has copied all the cells, so the DNAs will be produced in fluids, in sputum, in semen, in everywhere, in breast. If you have the virus and then you are breastfeeding your child will get it. Doctor, is it possible if the cell it duplicates is already a cell that is abnormal and duplicates, such as cancer or diabetes? Yes, it is. Now, diabetes is not the same as this one, because diabetes is not, it's insulin resistance. Diabetes is insulin resistance. There is no virus that is coming in to copy your DNA. But cancer is another thing. Cancer is something that has mutated by itself. Cancer is something that has mutated by itself, the coffee cake. But here, it's like the HIV virus. A virus cannot multiply by itself. It needs the host to multiply. So a virus like this one comes with this strand. Why it is called why it is called an RNA virus? It's because so it has something called uracil. Your DNA has thiamine. So when it is coming to copy to multiply, it removes this uracil. So it copies and leaves another uracil, and then it produces a virus. Because it is using you, it copies and then it produces another virus. That is how they produce. You understand? That if you have not understood, please request to I repeat. Benjamin, should Jamaican uncle be vaccinated forever before going to Kenya? Is there a vaccine for Ebola? If you are coming to Kenya, we don't have Ebola. If you are coming from a country that has that is from Kenya, we don't have Ebola. The US does not have Ebola, so there is no restrictions of travel. What they are doing is they want to create of same to COVID, whether you are going to was worse. Yes. It is because of when you get a virus, the inflammatory coffee cakes. When you get a virus, the inflammatory process of your body is what causes the insulin resistance, not the virus. So you are not diabetic, but whatever you are undergoing is what is causing the insulin. Brenda, if Jamaican uncle is coming from the US to Kenya, that should not be a worry, because Kenya, there is no case of Ebola. The only thing that is said is they want to build a center for quarantine. So I don't understand that thing. It's political and government to government. So I won't talk about that, because most of the Kenyans and even the courts have not agreed. I heard the courts disputed it. So I will not go to that more. It is my pleasure. Welcome, Coffee Cakes. Majay, welcome. We are talking about Ebola, Majay. Now, let's talk about human-to-human transmission. Blood. If you have the virus and then you give it to another person, that virus continue copying the DNA of the other person as it spreads. Vomiting, urine, feces, semen, breast milk, and sweat. Contaminated objects like needles, syringes, medical equipment are the problem. Not spread by casual contact. You know, casual contact means if you are walking and then someone or you shake someone's hand and the hands are washed, maybe you cannot get it. Maybe if you shake hands and then the virus is in the hand and then you lick your hand, that can be a problem. It's not spread by airborne like flu. You know, flu, if you sneeze and a person is near you and sneeze and receives it, that person can get airborne. It is not that one. That is vector spread. Mosquitoes does not spread this. The way mosquitoes spreads malaria, they take the chisels. Mosquitoes take the parasite in them, and then when they are having the meal in your body, they they release. Thank you, Brenda, for looking out for me. I was also I will also ask my doctor about it. Oh, okay. No worries, Jamaican uncle. For now, there are no restrictions, and I don't know if there is a vaccine for Ebola right now. And even if there was a vaccine for Ebola, it will bring a problem. Do you think anyone would want to get that vaccine? Let me ask, guys, do you think anyone, would you get, let me ask, would you get Ebola vaccine if it's rolled out? Now that is the poll. Anyone, you can answer yes or no. Yes or no. Will you get Ebola vaccine if it is rolled out? You can answer that poll. We see how many people will get the vaccine and how many people will not want to get the vaccine. Now let's continue giving the poll and liking the channel if we are continuing. Now we have said Ebola is not spread through vector, meaning when you sneeze, when you're talking to a person who is here, like flu. You know, sometimes when you are around people that have flu, you can get flu. It is not spread through mosquito. It is not spread through mosquito. It is not spread through casual contact. Casual contact by shaking hands sometimes, and you are taking care by sanitizers, you cannot get it. You know, you cannot get it. Now, pathophysiology of Ebola. How does it get to a person? How does this Ebola get to a person? Let's get and see. If you are coming in right now, you are a new person, please welcome to this chat, welcome to the chat. Always subscribe if you are new and let the people know that you are here. Oh, Stan's Kitchen, welcome. So welcome to the chat. Welcome to the chat. Now, this is how the virus comes in. The virus enters through broken skin, your skin. If you have a wound, it can enter through that wound to the bloodstream. Mucous membrane, kissing, having sex, mucous membrane. Those are eyes, nose, and mouth. So kissing, holding each other's hands in public, and then you take the same hand, you want to remove something in your nose, you know that is mucous membrane. Eyes, someone sneezes, achoo, and then it drops on your eye, it can spread, you know, mucous membrane. The virus initially affects monocytes, macrophages, and dendritic cells. The virus initially infects them, monocytes, because we said monocytes. Let's see how they affect them. Wait a minute. Macrophages. Why does it affect the macrophages? Why? Because they are the ones, you know, natural killer cells, macrophages. When you get a virus in your body, what it does, it comes around that virus, engulfs it. As it engulfs it, it is affecting it. So it binds to the proteins of these cells that help your immunity. The cells that kill, they know how to evade these cells. They know how to stop these cells from killing it. So they take some proteins and shield around themselves. And then the virus, when it envelops, fuses into endosomal membrane. FRC, welcome to the chat. Dorothy, welcome. The RNA of the virus, just like I said, you know, sometimes it's good to draw. Kingray, welcome Kingray. Welcome to, I'm explaining a very important topic here. I'm explaining a very important topic. So when this virus gets to your body, this is what happens. The macrophages and dendritic cells come like this. They go around it, and when they go around it, they have to remove the acids to kill this virus. But the virus inside has some protective way of protecting it from. Please continue to the poll. Remember, we have a poll. If the Ebola virus will be right now rolled, would you get it? Now, when it comes to engulf, it stops it, those chemicals from killing it. So what it does inside, it removes the RNA to the cytoplasm. Cytoplasm is not the nucleus. So the RNA continues to multiply inside the cell, and then after it has multiplied, what does it do? Well, after it has copied your DNA, it copied your cells, it has copied, it bursts. Look here. It bursts. It starts your cells, your cells of the body. When you have got the virus, they come to attack it. When they come to attack it, it feels that it protects itself. So inside the cell, as it's protecting itself, it releases the RNA to the cytoplasm of the cell. The RNA enables multiplication of the virus, and then it releases. Now it releases. That is how it is able to evade. To evade is to stop your body natural immunity too. I can see Smiler, welcome. Yeah, Judy, welcome. I miss you all, guys. Yeah, I miss you. Welcome again. Jamaican uncle has said today I'm energetic, you know. Efasi Lipenga, welcome. Stan's Kitchen, everyone. Major B, Jamaican uncle Brenda, Coffee Cakes, welcome. If you have a question, please link me up. Ask the question. Remember, there is something, the poll that is going on. Ask there, Paul, would you receive Ebola virus if it is rolled out right now? Tell me, would you receive? Now, let's continue. I've told you how it engulfs. Now, this is your DNA. This is your DNA. This is the Ebola virus. When it comes in here, it is like this. When it goes, it copies this plus another uracil. So it continues to create the Ebola viruses. Now, it affects these cells. We talked about monocytes, natural killer cells, dendritic cells, and those are your body immunity cells. You have seen how it affects them when it is fighting. This is how it affects them. This is how it affects them. Now, let's talk about viral replication. Viral replication. The virus replicates rapidly within infected immunity cells. Imagine the immunity cells, they are going to fight this virus, and when it gets to your body, it can get through your body through blood, saliva, vomit, urine, semen, breast milk, sweating, and contaminated needles, syringes, and medical equipment that are contaminated, So when it is spread through and it gets to your body, when these cells come to fight it, it shields itself and releases the virus RNA. So the virus RNA enables to copy more, to create more viruses through your DNA. And then they come out to be strong. And when they come out, what happens? When they come out, it continues to work as a virus. Now, viral replication. How does it replicate? How does it, multiply? How does it multiply? The virus replicates rapidly within infected immunity cells. The dendritic cells, the macrophages. When I'm saying immunity cells, are the cells that are helping you, your body is helping to fight this virus not to come in. Large numbers of viral particles are produced and released in the bloodstream, just how I have explained. Large amounts. You see, it was one. It has produced many and it has released in your cell, one cell. This causes massive, more viruses. It's called viremia. Widespread dissemination. Widespread dissemination in your body to the liver, spleen, kidneys, adrenal glands, and lymph nodes. Lymph nodes, tonsils, axillary, inguinal nodes, and then it continues to spread and spread. Now, what is the consequence of this spread? You will get producing a cytokine storm. Cytokine, when infected macrophages release excessive inflammatory cytokines. Those are like, let me say, tumor necrotic factor, alpha. They release this so that your body cannot tumors. Tumor necrotic factor is something that is released from your cells when you have cancers, to stop cancers from going on. It stops you from getting more cancers and your cells not to die faster. Another thing they produce is called interleukin 1 and interleukin 6 and interferons. There is something else called prostaglandin. So when all these are released, you start having inflammation everywhere in your body. Inflammation is hotness of the body, swelling, redness wherever all blood is coming. When somewhere is infected, like when you hit here, prostaglandins are released and the place swells. So blood comes there so that it can bring more. It can bring more nutrition and also it can bring tumor necrotic factor and macrophages to clear. So when the cells, this virus is in your body, wherever it is, it produces tumor necrotic factor, prostaglandin, interleukins, and when it is producing them, do you know what happens? Where the virus has produced inflammation, you start bleeding. And you remember, we said one thing, it is hemorrhagic fever. It is because you are bleeding because this cytokine storm, we call it cytokine storm. The macrophages, your cells of immunity, have come out and they are trying to fight. They are trying to fight this virus, and your body is responding by bleeding. Because when you are swelling, because if tumor necrotic factor, prostaglandins, interleukin 1 and interleukin 6 and interferons, macrophages have released in large numbers in your body, do you know what will happen? Macrophages help you to kill diseases, to remove them in your body. And now this is a virus which is being produced so faster. It is being produced so faster through this way. And more viruses are copying your DNA and releasing more viruses. It means the cytokine storm, more inflammatory cytokines are coming. Your body is releasing the inflammatory cytokines at large numbers. And they have said, what is inflammation? Inflammation is swelling, redness because more blood is coming where the inflammation is, and heat, hotness of the body. So if blood is coming everywhere, what does it say? You can bleed in your gums. Inside your kidney can bleed. Even your brain, if it goes to the spinal cord to your brain, you can bleed. You understand? You understand how now bleeding comes? That's why we said from the beginning, it is called hemorrhagic fever. It is called hemorrhagic fever. Anyone with a question? Anyone with any question and wants to know? We are still getting the poll. We are still getting the poll We still have 50-50. 50% says yes and 50% says no. So the poll asks, would you get Ebola virus if it is rolled out? 50% says yes, 50% says no. So let's continue to poll. We see. Now, we have said, so how do doctors treat it? The symptoms, the bleed. Treat it. I think you are meaning treat it, the symptom. We will reach there, but in a virus you can treat the symptom by, if you are bleeding out, you are given blood. If you are having so much fevers, you stop the inflammation and the fever. Let's continue. The consequence of the cytokine storm, your macrophages releasing so much. You know, when you are hit a place, macrophages release tumor necrotic factor, interleukin 1 and interleukin 6 and interferon. And the consequence of all this is pain, redness and what I've explained. There are your cells of the body trying to help you from having a problem, the place that is affected dying. But as it is helping you, it is producing so much cytokines, and what is happening? You are bleeding now. So as this is going on, because the signs of inflammation is heat, redness and swelling. Some place your face may swell, your legs may swell, high fever, because inflammation is equals to high fever, tissue injury, like the kidney, the liver inside can swell until it is injured. Shock. People get shock, hemorrhagic shock. Because you are bleeding, you get hypovolemia. That is shock. Hypovolemia is you don't have enough volume of blood because you are bleeding. And then you can get multi-organ failure, because now every organ in your body is undergoing inflammation, and the cells of immunity are releasing inflammatory cytokines, inflammation, tumor necrotic factor, interleukin 1, interleukin 6. You can go to shock. And then there is something inside your blood vessels, like the veins and the artery. There is damage. We call it endothelial damage. The virus and the inflammatory mediators damage endothelial cells. The virus and the mediators damage the endothelial cells inside your blood vessels. It damages. So your blood vessels does not work well, because your body is producing inflammatory markers like tumor necrotic factors, all those that help in inflammation. And the virus also is completely going on by replicating and producing more and more, you get. So you will have leaking from the veins, from the artery. You start leakages, plasma loss into tissue, because now your blood vessels are leaking inside. You start having problems with flow of blood. The permeability, the pores that are controlled so that some fluid can enter, it becomes a problem. So you start having low blood pressure, you swell, face, legs, and shock. You start having a shock. The other thing that will happen is, because the virus is everywhere, platelets are affected, coagulation abnormalities. When you are cut somewhere, stopping the bleeding becomes a problem. Tissue factor release from infected monocyte causes DIC. You know, disseminated intravascular coagulation means you can't stop bleeding. The bleeding continues and continues, non-stop, without stopping. So these monocytes, the cells help you the cells that help your body in inflammation. You know, inflammation is a good thing. Inflammation helps you to stabilize your body. When you are feeling so much fever, it means your cells are fighting the parasite that is in you. They are fighting it so that it cannot disturb you. But the same cells, the things that they release to your body can affect you, can really affect you. So what does it say? We call it DIC, because when you are bleeding, because monocytes are like which cells? Let's see, monocytes. Monocytes are cells. Monocytes are cells that are in your body, are types of white blood cells that are in your body that help you to fight diseases. They are white blood cells called monocytes, called macrophages and dendritic cells. So they are the ones which release these factors to struggle and destroy. You get? To struggle and destroy that. But when they are releasing these tumor necrotic factors, interleukin 1, interleukin 2, and all those, what happens is it can make you bleed, because now your platelets and factors of clotting cannot work. So you bleed, you continue, widespread clot formation, consumption of clotting factors, consumption of platelets, and you continue bleeding. You cannot stop the bleeding. And you see, it is not now the virus, it is because of the immunity of your body trying to fight hard. And your immunity of your body, as it fights hard, the white blood cells releasing macrophages and dendritic cells. The dendritic cells now makes your body to stop the clotting process, because they are focused to destroy this thing. So you continue bleeding. As it is fighting for yourself, this other side, it is having a bleeding tendencies problem. So patient may develop bleeding from the gums inside your stomach. When the people are injected, where you are injected, the capillaries bleed, you know. So hemorrhage is mainly due to damage of your vessel inside the blood vessels, veins and arteries and capillaries, and thrombocytopenia, destruction of things like platelets that helps you to clot, and disseminated intravascular coagulation. That one is destruction of release of the monocytes, the macrophage and dendritic cells. When they are released, the white blood cells, whatever they are releasing is what makes you to bleed completely. As they are helping you, you are bleeding completely. And we will have organ damage like the liver. The cells of the liver, they are called hepatocytes. Elevated enzymes of the liver. The liver produces more enzymes. Welcome, my friends. I can see people peeping in, peeping out, peeping in, peeping out. When they see this is so weird and hard, they go. Don't go without liking. Check if you have liked and check if you have subscribed to the channel. Check if you have liked, check if you have subscribed to the channel, my friends. Don't leave without subscribing to the channel, and don't leave without asking a question. If you are new to the channel, let's talk at the chat. I can see our poll is going on, and several people are saying now it is 58%. 58% have said no, I cannot get that one if it comes. But 42% are saying yes, why not? So let's continue. Before we finish, we see how many people who can get that vaccine, if it is there and if it is rolled out. Welcome. If you are a new person, tell us where you are watching from. We are talking about Ebola and learning how things happen. So in the kidney, in the adrenal glands, they start to rot, necrosis, because when the macrophages are released so high, those interleukins, tumor necrotic factor and other factors, they make these glands to rot away. They make these factors to rot. So you get necrotic tissues. Necrotic tissues are tissues that are rotten. Imagine inside your organs, because your body is producing so much enzyme and they are fighting this thing like, we want this thing to die. You understand? But the kind of chemicals, they are called cytokines. Interleukin 1, interleukin 6, interferons, and the other one which is called prostaglandins release. You know what happens? The tumor necrotic factors makes your body to start shutting down. So the kidney becomes a problem. Shock, you have dehydration, it is swollen, and direct viral injury. That the way we have said happens. So simple thing. This is the simple thing that I've said. Virus entry, infection of it infects the cells of immunity. Why? When the cells of immunity comes to destroy it, it covers itself and releases the RNA, which is the virus, to the cytoplasm. You see how this thing is very fun. This is macrophage, white blood cells, dendritic cell that is coming to kill this virus. But as it is trying to kill it, it covers itself, but in turn releases the RNA, which has uracil, copies, and then releases more virus. So the macrophage cannot kill it. So we call it evasion process. And then we have viruses that are very many that are released to your body. The same process continues. You have something that is called cytokine storm, because cytokine storms means those things that are helping your body to fight infections and such viruses. Natural killer cells, tumor necrotic factors are released a lot, and your body gets damaged. Inside your blood capillaries, damage. Inside the kidney, damage. Adrenal gland, damage. You start having fluid leaks. So if your capillaries, if you are let's say, what else? Not capillaries around. Your veins, your arteries inside are damaged. What happens? You start having leaks of blood, leaks of plasma. Your blood pressure goes down, and then having DIC, disseminated intravascular coagulation. Blood is you are just bleeding. Then you go to shock. You have multi-organ failure, and if you are good, you can survive. You are good, you can. So the incubation period is 2 to 21 days. You can start having it, the symptom from when you get it, you can stay for 21 days is 3 weeks, 8 to 10 days. 21 days, it depends with a person. From the first day to 21 days is incubation period, is still multiplying and going on. Or nowadays, if you get that one which is so severe from the Congo, it can give you like 8 to 10 days. 8 to 10 days, then you start having fever, severe headache because of hypertension. You are just tired, fatigue, muscle pain, joint pain. Your joints are painful because it's a virus. You start having a sore throat. But as you continue, because you have said it affects the mucous membrane, and you know where the mucous membrane are: the mouth, the nose, inside the stomach, the rectum, the small intestines there. What happens? Abdominal pain, vomiting, you cannot hold food again, diarrhea, you start having a rash in your body. A very funny rash. It can be erythromatous like rash. Conjunctival injections, you start having redness in your eyes. So when it comes to Now, or am I going too fast? Someone tell me, am I going too fast? I can see we have 58% and 42% going on. Let's continue. Let's continue. Let's tell people that we are talking about Ebola, my guys. Just imagine Ebola. And most of the Ebola virus, you see, they are named according to where they were found. Let's revisit that again. Let's revisit what is Ebola. The first thing we talked about, what is Ebola. Am I going so fast, my friends? If I'm going, the symptoms, that was the last question. Tell me, guys, if I'm going fast, tell me, Doc, you are moving so fast. Come slowly. Come slowly. So if you are new and you are just watching while silent, please tell us you are watching from Kenya, you are watching from the US, you are watching from African countries, you are watching from any country that we in the world that we know. So, my friends, Ebola is a deadly disease. According to just how I've mentioned, you see, it's very deadly. Ebola virus is a severe, often fatal viral hemorrhagic fever caused by virus Ebola. Virus called Ebola, gene Ebola. It is primarily affects humans and not human primates. Pole. Pole. Oh, Brenda, it is pole. Pole is slowly. Pole, let me say it. Pole. Like that. Pole. Pole. Slowly by slowly. So, we have said it's hemorrhagic fever, and now you understand why it is called hemorrhagic fever. Because of the monocytes, the white blood cells that produce cytokines, like tumor necrotic factor, interleukin, and all those are bringing inflammation towards your whole body, producing inflammation towards your whole body. You see, it primarily affects humans and non-human primates. So, the causative agent, we have said we don't have just one type of Ebola. We have Zaire, Sudan, Budibuyo, Thai forest, and resto Ebola virus. All these were categorized and found in Africa. And West Africa. The natural reservoir is believed to be fruit bat. So the virus is preserved in a bat called the fruit bat, a bat that loves fruit a lot. But the funny thing, it does not affect the bat. The bat transmits it to primates. You know, you are a primate. We are called Homo sapiens. And the baboons also are called Homo. I don't remember. I'm not a historian so much. I think it is Homo pithecus. So it affects us because of the category of our DNA. Our DNA can be copied by an RNA and produced as a virus. I rather prevent rather than cure. Uncle is in the category of no. Let's continue. Let's see who will win, no or not. So you see, this one, it started from the West Africa and it is coming directly to Central Africa because of spread. Democratic Republic of Congo, Uganda, Guinea-Bissau, Sierra Leone, and Liberia. Yes, it doesn't like a bat. Imagine. Hey Benjamin, Peter, welcome. Peter, you are the first one today from Norway. Welcome, Peter. Like, and share this talk. In a bat, imagine the virus stays in a bat, but it does not affect the bat. I think it's because of the bat's DNA. Maybe the bat's DNA. Let's see the journals what they say. Let's see about it. It's something that is under investigation. So what I think is because it does not affect the DNA of a bat. Maybe their DNA is different from ours. Let's see. Yes, welcome everyone. If you are new, please comment, say you are here, give us a like. Let's get to more likes today. Why Ebola does not affect? Ebola virus can infect bats and humans, but the outcome is very different. Bats are natural liver and co-evolve with the virus. The virus adapts, duplicates without killing the host. So humans are accidental hosts, but bat's immune system has a control response. So there is a way some animals control a virus. So humans, we don't have the capability of our body's immune system does not have the capability of controlling the response of the infection. Humans, we don't have the capability. So let's talk about something else. Let's talk about transmission we have transmitted. So Smile in the City, humans, we don't have the immunity capability of controlling and living with that virus like other animals. Like the birds can live with that virus, control it, not to destroy. But humans, we have high immunity. Maybe bats does not. And the way you have seen is when the white blood cells are released, the monocytes, the macrophages and dendritic cells, they are the ones which releases some cytokines. And those cytokines, like tumor necrotic factors and interleukin 1 and interleukin 6, and interferons, are the ones which makes you to bleed. So the virus just comes in and activates them to produce all this. And then what happens? Your body now starts to bleed. If we had a way to control the white blood cells not to produce so much interleukins and all sorts of these, we could not be having all this problem. So the bad thing is humans don't have the capability, but the other animals like the bats, they have the capability. You see? So incubation 2 to 21 days, mostly it has reduced nowadays 8 to 10 days. We have seen the symptoms. Does that mean we can? Yes. If that one animal is having it and controlling it, if it gives you, it means it will damage you. That's why we have said it is a zoonotic. It is got from the primates, baboons, monkeys, bats. You get them, they live and control it, but human does not have the capability of controlling the white blood cells that are releasing these inflammatory markers. The humans don't have. In my study, or in what I'm thinking, is the virus itself is not the problem. It only activates the immunity cells to work on you thoroughly. The white blood cells, it activates them. As the white blood cells are released and they are going to kill it, it protects itself and releases RNA. The RNA produces more viruses, and then these cells, as they are working on it, they release cytokines. They welcome Simple Kate, welcome to the chat. They release more cytokines to the body. So the cytokines that the white blood cells release, the cytokines. Now, the cytokines are the cytokines are tumor necrotic factor, interleukin 1, interleukin 6, and interferons, are the ones which kill viruses, destroy it, and removes it from the body. Life with Serena 032, welcome. Simple Kate, welcome to the chat. We are talking about Ebola. It's been long, man. I've not come online the whole weekend. So give me the likes and tell me you miss me. Tell the doctor we miss you. Eh? Tell doctor we miss you, man. We miss you, you know. Yes, welcome everyone. And if you are new, subscribe, my friend. Don't go just watching. You need to get notifications that Benjamin the Wise Guy is online. So subscribe. So we have talked and we have said, I miss you, Benjamin. You know, I love you, right? Thanks, Simple Kate. Thanks a lot for that. So we have said, you understand that this ideology of the virus, your immunity cells, is anyone getting that thing, that concept? Is anyone getting that concept? The virus comes, the zoons, I like saying the animals, I call the zoons. How are you, Benjamin? Rosanna, I'm cool, I'm back now on track. The animals, the baboons, the monkeys, they know how to their bodies know, the bats, their bodies know how to control it. But when you come into contact, now your body starts having that immunity factor to fight it. And when it is fighting this thing, it releases inflammatory mediators, interleukin 1, the white blood cells, monocytes. White blood cells, monocytes. Let me explain this. I just want, hello Benjamin, you're watching from the start. Thanks, Marcia Thompson. Although, Marcia, we always meet on Jamaican Uncle. You know, we are one thing. Marcia, when I'm coming to Jamaica, just know you are the first one I'll be visiting next year. Marcia, if you just see me saying I'm off to Jamaica, no, it's some other people. Now, let me explain this. I don't want this point to go away without being explained. You have cells that are called macrophages. White blood cells. White blood cells, I want to explain, and that's why I want everyone to know what Ebola does. Today, if you don't understand, please tell me, I've gone for so long, and please, we are having a poll. Would you get that viral vaccine if it is rolled out? Come to the chat and tell us. Would you get that vaccine if it is rolled out? Tell us if you will get it. Now, look at this. White blood cell. You have some kind of white blood cells that are called monocytes. So monocytes are macrophages and dendritic cells. So what they do, macrophages and dendritic cells, what they do is this. Please, if you have not liked, give me your like, my friend. Please give me your likes if you have not liked. Come to the chat and give me your like. Your like will give more impressions. And if you are a new person, don't just sit there, my friend. If you are new to the channel, come out and tell us you are new. And Rosanna is telling Smiler not to sleep. Now, when this is a virus, you have the virus now in the body. Let me draw the virus with This is the virus. You see, let's assume this is the virus come to your body. And then you have something that is called white blood cell. There are several types of white blood cells. We have basophils, mesophils, lymphocytes. You see, types of white blood cells. I want to explain that so that people can understand. These cells help you for immunity. They help you for immunity. So when you have these viruses in your body, what happens? This happens. The monocytes, the macrophages, they come. And eat this. They come and eat it in this way. It's called engulfing. It is called engulfing. So when they have eaten it like this, they start producing tumor necrotic factor at their place. Interleukin 1 and interleukin 2. It's 6, and interferon. So they destroy these cells and they release it so that it can be cleared from. When they have destroyed it, they release it so that it cannot harm you. But the funny thing is, this is the funny thing. When it is inside there, the cell protects itself. The cell protects itself and releases the RNA. This is now a cell. It protects itself and releases RNA. So the RNA goes to copy in the, the RNA goes and produces more viruses, and then it releases more viruses. Now this cell inside releases more RNA, the RNA produces more viruses, and so here it is like, yes, thanks Smilers, thanks for that. Please double tap on the screen if you are using your phone to support Dr. Benjamin. Smile, I'm watching too. Okay, nice. Let's get the likes, man. Let's get the likes. And if you are new, just know you are a friend of us. Come out and tell us where you are watching from. The poll has stuck. Please, we have a poll. Say yes or no. Will you get Ebola vaccine if it is rolled out? Yes or no? Let's continue polling. Now, that is how the virus affects you. When it gets to your body, it affects your cell. And what your cells of immunity, when they are fighting it, are releasing to fight it, is what also makes you to start bleeding, have inflammation. Please start this from the beginning if you have not watched. See, the cells of your body, the macrophages, the white blood cells, we have several, but the natural killer cells, they produce interleukins at high levels, cytokines that kill these viruses at high levels, but in turn, it is affecting you because the virus is affecting your inner vessels, endothelials, inside your vessels, inside your blood vessels, inside your veins, inside your arteries, inside your capillaries. So you start leaking fluids outside. Instead of being inside your blood vessels, it is leaking in your muscles, causing you to swell, causing you to have swelling, limb swelling, and causing you to vomit, having stomach problems because of ulcers. because this virus affects mucous membrane. Mucous membrane are in the mouth, stomach. You see, so its work is just to come and start the process. So when it is affecting when the white blood cells come to fight it, guys, I see many people coming in now. Please, Paul, and like. If you have not subscribed, let's subscribe. If you have a question, don't go with your question. Ask your question. We will answer it. We will discuss it. See, so when it is inside your cell, inside your body, it is giving effects and coming out with very many viruses that continue the same process. So let's talk about anyone with a question up to there. I think you are now understanding the process. I think someone is understanding the process of replication, the process of how this virus comes. Yes. Anyone else who is hanging? Let me give some time before I go to the next treatment and prevention and complication. If you have a question, please ask now. It's your time before I go to treatment. It's your time before I go to treatment, my friend, because that is another area of concern. Because you see, someone asked about treatment a long time ago. Let's talk about treatment again. Let's talk about treatment. Let's talk about treatment. Anyone with a question before I go to treatment? Ask a question. Please ask a question. We discuss that question. Ask a question. We discuss that question. Anyone with a question? Anyone with any questions? Who has any question? I'm waiting for a question before I go to treatment. About Ebola. I think now you are understanding what Ebola is. And I know where you are. You have started to know why it is very difficult to treat it. I know someone has started knowing why it is very difficult to treat it. I know someone has started to know. Oh, so this is why it is very important, and why people are if you have heard or you have seen those clips of Ebola, you have started knowing why people do what? Bleed. Why people bleed when they have Ebola. I think you have started loading now. Oh, that's why. You know. So, can I continue? If there is any question, can I continue? Can I continue, my friend? Or anyone has a question? No, let me continue. Let me continue, because people are listening and not answering. Keenly, why are you listening and you are not answering me? Let it be interactive, my friends. Let's be interactive. Let's get interactive. You know, let's get interactive. Now, something called treatment. How can we treat Ebola virus? How can we treat Ebola virus? This one is not Ebola virus is not a bacteria that will give an antibiotic and it kills it. You know, antibiotics act by going inside a bacteria and then tampers with the proteins of the bacteria, and then it dies. Now this one has no that. This is a virus. It goes, copies your DNA and multiplies inside your cell. So if you can get a drug to kill it, it means you are killing your own cells. But if you get a drug that can identify specifically, this cell is infected, let me kill this cell. This cell is infected, let me kill this cell. If that drug is there, it can be a great achievement, because even for people that have acquired HIV, we can program a drug like that and it helps. But it is so hard. Something that is multiplying inside your cytoplasm and in your cell. It means you can kill your all of your cells, then your immunity dies and you die. So inside the laboratory, we go and look up at full hemogram because inflammation is going on. So most of the cells of immunity will die because they are releasing so much cells and die. So in the full hemogram we check on something called neutropenia. We check at the liver. We see if the enzymes of the liver are elevated. We call it liver function test because of the inflammation. We check at something called PT and PTT, prolonged prothrombin time and thrombin time. This is about coagulation of your blood, factors, how your blood can coagulate. Something called the dimers. These are done in the laboratory. Thrombocytopenia, factors of clotting, the platelets, are they dying or clotting? You see, confirmatory tests, PT, PCR, polymerase chain reaction to see the Ebola virus. That's what we do. There is something called antigen test. Everything contains the antigen. So there is a strip that you place your blood, just like the HIV, because even the HIV has got its antigen. When it is rising and it reaches a place you see it has said, yes, this has an antigen of Ebola. We can do a culture test in very specialized laboratory. Culture test for it. We grow it. We see how it is. Those are the ways we know this is Ebola. So to confirm that this is Ebola, we have polymerase chain reaction, antigen test, and ELISA test, and culture. We grow it, and then we find that this one is not just a flu. This one is specifically this is Ebola specifically, and this one is got on PCR and polymerase chain reaction to see the real Ebola virus. You see, this is Ebola. Do microscope, you see, and for real, this is Ebola, because every virus has got its strand. It has got its shape. Just like you are not resembling someone else, the viruses also does not resemble themselves. So when you do PCR and you look for microscope, you see this is Ebola. Now, how do we treat after confirming that this is Ebola in the laboratory? Aggressive fluids. Because you are bleeding, we give you IV fluids like sodium chloride, Lingus lactate, all those. We give you some glucose. If we check, every time we are in the hospital, we check on your liver and your kidneys. Are they functioning well? Are they okay? So we continuously check on them to find out how they are doing. So if your sodium is down, we increase sodium. If your potassium is down, this is called supportive management. It's not treatment. We are helping your body to balance whatever that it needs. So when it balances, your life continues all normal as your body is clearing this virus. You see, because now you are bleeding and maybe you have a cut that is not healing, we do what? We give you antibiotics so that you cannot get another infection which is bacterial, and then it becomes worse as we have a viral infection. So if we check on your blood products and we see your HB is bound, we give you packed blood. You see, there are several things like specific therapies like Imezab and Ebanga. These are some drugs that helps you to improve in survival. You remember the time of COVID, we had these monoclonal antibodies like Intazumab. They were calling so many this. They are monoclonal antibodies. They improve survival where they are giving them. They help you to continue. As you are clearing the virus in your body, we give you some fluids. There is a vaccine that is called Ebola. It helps you to protection against Ebola virus. But so some people here are saying they can't get that vaccine. It helps to protect. You have the antibodies so that your body can know how to work out this virus and destroy it earlier before it destroys you. Infection control. Now, the main thing here is infection control, because for my treatment here, you have not had anywhere that I've said this drug treats Ebola. You have not said, you have seen just conservative, supportive management. Only supportive management, something to support you to, as the body is clearing the virus, it is supposed to go on. You see? So, here is how we can prevent the infection. You isolate the patient so that he cannot come to contact and spread it at home. Using personal protective equipment is very important for doctors handling these patients, so that they cannot carry the virus at their homes. Hand washing hygiene. Are they different types of Ebola and they treated the same way? Yes, we have said we have several types, the genes of Ebola. The causative agents, Zaire, Sudan, Bugio, Thai, and rest of. Both of them the same way. They are not treated different. But we have said there is no exact treatment, so we just give supportive management, because you cannot have a drug that can kill a cell that is multiplying inside another one. So you see, we have infection control by isolating the patient away from people, not to spread it. Hand hygiene, very important, because if you shake someone's hand and this person has Ebola, maybe you will not get it because the fluids may not be on the hand, but you can get it if this person is always having the fluids in the hand, taking the nose, and if you wash, you will not get it with soap. We should get these people contact tracing. Someone had hemorrhagic fever, and what says that this is Ebola and this is normal fever is, you have seen, we have talked about hemorrhagic fever. Someone bleeds from the gums, the nose. If you urinate, you see blood, and you have seen why someone bleeds. If you see someone is having a high fever and is bleeding from the gums, or red eyes, or the nose, bleeding from the nose, you need to tell the required people, health services, report it very fast. High fevers, having a flu, a sore throat with bleeding from the nose and mouth and gums, report to the health people at your area, the organization at your area, very fast, so that this person plus the people who are in contact with the person can be isolated. It is very important when you do this isolation to avoid spread, because it is not curable, it is contained. So that is all about COVID, unless any not COVID, Ebola. All about Ebola that we have talked about. I will ask anyone with any question. Is there anyone with any question? We have complications like hypovolemic shock, septic like shock. We have seen disseminated intravascular bleeding from everywhere, and it's not being stopped. Acute kidney injury, liver failure, multi-organ failure, and if you bleed a lot, you can die. So the multi-organ failure is what makes people die. I think I've really explained this so well, and I just want to ask a question. Who has a question? That is my question. What do you think Ebola is now? What do you think Ebola virus is now? What do you think Ebola virus is now? As per you, what do you think Ebola is? I've talked a lot of things, and it's now time for anyone to ask any question. Anyone, you can ask any question. Let me give like 10 minutes before I log off. Who has any question to come out with? Who has any question? I can see my friends are here. I've not talked to my friends for so long, the whole weekend. Miriam, Brenda, Efasi, Smiler, all of you. Rosanna, where Rosanna is right now is very late at night. Marcia, Simpoket, Jamaican Uncle, every one of you here. Welcome, boss. So it's time for you to ask me a question. We discuss the myths. What are the myths that you've heard about Ebola? Let me know right now. What have you heard about Ebola that I've not said here? There are so many things that are going out there about Ebola. So many things that are funny things about Ebola. Thanks, Brenda. Thanks for that. I know there's someone who is still thinking of a question, and worried on how to ask me that question. So who are you? Who is not? Anyone with any question, my friends? Questions are good. So the weekend has been long here. I've been having a break. Before I had a break, we had so many things out there doing. That's why I've been off for some time. But we have to continue with our teachings. We have to continue with our interactions, and let's continue learning something, and we'll be good at the end. So I think there is no more questions, and everyone who's been here, I thank you for coming in. I can see, yes, it's a killer virus. I can see our poll, 50% of you are saying they will get the vaccine, and 50% of you are saying they will not get the vaccine. So it's 50-50. It is 50-50, and we all have our way. If the government says it is good for you, you have to decide if you can get it or if you cannot get it. So some 50% have said they can get the vaccine, and 50% have said no, I cannot get that vaccine. So that is it. Doctor, if Ebola has broke out in the European country, will so many people die? Now, in the European country, Smiler in the city, according to me, so many people will not die. because most of Europe countries, although there are some places that are crowded, I've not seen the crowding in Europe like the ones that are in Africa. African countries crowd a lot. African countries, ask Jamaican uncle, ask Ridley, all those people that have been in Africa, mostly in my country. When you go to towns like Nairobi town, you will see so many people crowded. And you have seen the exchange of fluids. Or, Smiler, are you meaning in European country people kiss each other so much? Smiler, tell me. Yeah, because you have seen it is got through body fluids, blood, you know. So if it is a place where people kiss each other so much, that will be a problem. People will kiss each other until yes. That is another question. Smiler in the city. How is the interaction of people where you are? And if you have not visited African countries, but I think India is mostly crowded. I see videos in India, and I see India is really crowded. So if this virus gets into India, which is most populated, it will bring a very big problem. It will bring a very big problem. So I think it's in Smiler in the city. Why have you said about Europe? Maybe you have a point there. Maybe you have a point. Let me see. Well, maybe your assumption, I would like to know. What is the assumption you have about the Europe. You know, we have seen the best measures you can take when you want to avoid this is the most key factor is sanitation. I've seen the key factor here is sanitation. The key factor is sanitation. More money to do research. Yes, the only research you can do here is to get which are the research, because this is a virus. The research of HIV virus has gone there for so long. Has gone there for so long. You have seen something like COVID came, and there was no definitive treatment. You see, so this one, any virus that has come in, and there is yes. Anaitwa Niropa. So examine akona home. Na nini ingine? Now, most of the viruses that have been there most of the time are not, even if research continues, most of it comes out to be, we just contain it, and we let it, we like COVID, we contained COVID, and the research never brought in a very major thing. The only major thing that will come is how, when a person gets a specific virus, you can separate the strains. You can separate the strains. You see, that is the research that will break out. Now, I've asked about what do you think about Ebola and the treatment. Let me check on that child that has been brought in. I write treatment and then I come back. Let me get to that child and I come back. Just now, let's continue to ask the questions. Yes, it's Chua. Chua is here. So true, Doctor. It was unbelievable to me, amount of people, especially in Nairobi. Yes, some congested towns. And if you walk to India, you will be surprised. So you imagine the kind of a massive transmission that can be there around such populations, or around populations that are in a place like India, in towns. But you see, even if a place is having more population and the sanitation is given much priority, the spread will be minimal, you see. So it is important to take control when it comes to the spread by taking good sanitation. So everyone who is here, I can see it's Joy. It's Joy. Welcome to the platform. I can see you here. Welcome to the platform. So sanitation is the key factor, and the people who are hygiene. Smiling the city. It downs back to hygiene. And in towns, the problem is so many promiscuous people are spreading this. Parties, young people that go to parties everywhere, they should be contained. Spread through, you get a small house, 20 people in universities that are partying everywhere. You see, that is a problem. Social places like clubs, restaurants, and initially these problems are spread when you go to parties and celebrations. That is where problems starts from, because in parties and celebrations, mostly parties that are undergo at night time, you understand, and people are drinking alcohol and people are aggressive, exchange of fluids go on around, kissing, hugging, sweat. We have seen sweat can spread it. It becomes a real problem. It becomes a real problem. So everyone who is watching, my friends, everyone who is watching, it is very important when you are in African countries and you are at a place that you have had there is an outbreak of Ebola. Like in Kenya, I've not had any strike of Ebola. Where my country I've not had. The only thing is I've heard about the creation of containment center, and I don't know if it is underway because that is political. I don't know, but what I heard is the courts had stopped the process, so I really don't know if it is continuing. So you take control, but if there is a travel ban to a country or to a place, don't sneak. Doctor, you stop drink rum but use it to sanitize my hand. Yeah, I don't like alcohol, you understand? I don't like alcohol. Alcohol makes very many things to become problems. So if you like alcohol, please don't say I'm giving against you. That is my preference. That is my preference. Don't say doctor is speaking for me. No, I'm speaking for myself. Personally, I don't like alcohol. It's my preference. So for you who is liking alcohol, take it moderately. Don't be indisciplined. Don't be indisciplined, yes? But you can see the most important thing that is here in this, Dorothy, just go. The most important thing that is here is the containment of what? Containment of Dorothy. Mimi sitaki kusumbuliwa sai. Nasema BD 500 milligram BD. So you guys are now, well, you have the information. You have the information in you. And Betty is here. Betty, welcome to the chat. We have been talking about Ebola. You see, the most important thing about this virus is sanitation. The most important about this virus is avoiding gatherings, social gatherings, and some celebration. So if in your country you hear about Ebola strike somewhere and there is a social gathering, you know what to do. You know what to do. So that is the most important thing to do when it comes to Ebola. And not Ebola. You know, Ebola is a better thing than COVID, because COVID, it was like a flu. It is like a flu. So a flu, when you sneeze and someone is not wearing a mask, you can get it. Ebola is got through body fluids. Is got through body fluid. Welcome, Kate. Welcome, Kate. So, if it is got through body fluid, you can avoid. You can avoid. You can avoid. So, I have 3 minutes now. 3 minutes. So, if anyone has any question to ask, you can ask it. And if you have any topic that you think this one is important, we need to look at it, bring that topic up. Let's talk about it. Let's talk about it, because I was to do hypertension, to continue with hypertension, but there were some requests. The first one who requested was Queen. Queen requested we do Ebola, and that's why we have done Ebola today. Tomorrow we will continue with hypertension as normal. My friends and everyone, if you don't, let me give 2 minutes. If you have I have 2 minutes. If you have a question that you think you can ask right now, please ask before I log off. Thank you for tuning in. Jamaican Uncle, Simple Kate, Smile in the City, I can see Chwea, Brenda, Efasi, and Rosanna. I know Queen is listening. I know Marcia Thompson is listening. And Rosanna is around. Maybe Rosanna has slept. It's very late where she is. All of you that have been here, the coffee cakes is here. Thank you for tuning in. Thank you for tuning in. Thank you for saying thanks. I'll check your text on Instagram. Judy J Kingre, all of you, Marjay, I can see Dorothy. Thanks for tuning in and saying that you are here, boss. All of you, thank you so much for tuning in. Today I will not be here at 6. I will not be here at 6. Even Smiler, okay. At after 3 hours I won't be here. I want you all to stay cool, and if you have not got any, like someone has asked about Kenya, travel of Jamaican uncle to Kenya. For now we don't have any case of Ebola here. The government has not issued any travel ban from the US to Kenya, but if there are reports, maybe the progression will go on. So I think it's not, don't worry yourself when you're coming here or you are going to the US. You see, so if there will be a problem, I think the government will have come in and there will be some problems of travel. So guys, thank you so much for tuning in this platform, and also always supporting me. So we can meet tomorrow or after 9. I can come shortly. If you have a question, always my email, my number, everyone has it. You can text there and tell me about the question. If you feel you have a topic, let's meet. So bye. I see no questions. Let's meet tomorrow. Bye. See you guys.